Hi, I'm Dr. Emil Tompkins, and we're going to talk today about why is it that you're having so much back pain during your pregnancy. So, as you're going through your pregnancy, it's an exciting time. Baby's coming, you're looking forward to what that means for you and your family. But one of the things that you aren't looking forward to, or that you're probably not enjoying, is how you're feeling during pregnancy. A lot of people during pregnancy start to have increased pain and discomfort. And there are a lot of reasons why. But we're going to start with the first. During pregnancy, there are so many changes that are happening in your body. And hormonally, your body's preparing to carry baby, for baby to grow, for baby to develop, and for you to have a safe labor and delivery. So for all of that to happen, your ligaments, your joints, everything needs to be nice and loose and relaxed. So that's a good thing for the health of baby and for the ability to deliver safely. But that's not so good news when it comes to making sure that your spine and your pelvis are really nice and strong and stable so that you feel really good. And so when you're pregnant, a lot of times the joints are so much more susceptible to moving out of position, to creating more pressure in places that they normally wouldn't do that. There are a couple of things that you'll want to do if you want to relieve pain while you're pregnant. So let's talk about some of those things. Number one, you're going to want to exercise. You want to exercise in a way that's going to help your muscles to work well together. You're never going to be so strong that nothing's going to move out of position. But if your muscles are consistently working together and not so weak that when they become strained, they start to spasm and create problems, that will help you to deal with pain. So there are a couple of exercises that can really make a difference in how you're feeling, and so we'll talk about those. The next thing you're going to want to do is think about how you're eating, because inflammation can create a lot of the pain that you're dealing with. It's already a problem that things are out of position and creating more pressure on your body, but if there's more inflammation simply because of what we're eating, then you're going to have more pain simply because of that. So thinking about what you're putting into your body, limiting things like simple sugars, which are going to be highly inflammatory, and making sure you're adding nutrient-dense foods that are so packed full of nutrients that, one, you aren't tempted to overeat, but that you're also not eating things, or you're eating things that are going to be healing for your body and not inflammatory. So a diet full of vegetables, a diet full of good sources of protein. It doesn't have to be super lean meat, because if you're eating good healthy stuff, the fat actually is really good for you. It's when you combine high fat with high carbohydrate that we start having problems. So good sources of protein, nutrient dense foods, lots of vegetables, and nutrient dense grains. If you're going to have grains, nutrient dense grains are going to be the key. The last thing we want to do is we want to get everything into as good of a position as we can. We already talked about the fact that pregnancy causes ligaments to be really loose, the spine, the pelvis can move out of position, and that can cause lots of pain. Well, a family chiropractor who's trained in taking care of pregnant women regularly can work on moving the spine back into a normal position with really gentle adjustments. And then when you add your exercises on top of that, that helps to put things in a good position and helps the body to stay stable, helping you to feel better and have a healthier pregnancy. And that's what we want. Guys, I'm Dr. Emil Tompkins. If you need a family chiropractor, if you need a chiropractor who is certified to help take care of pregnant women during this incredibly important time in your life, then look us up if you're here in Southern Arizona. Have a great day. We'll see you soon.